Hi, I'm Dr. Holly German. If you think you may have adrenal fatigue, it's important to know which stage of adrenal fatigue you have because the treatment options will vary from stage to stage. First of all, adrenal fatigue staging is done after a doctor, usually a naturopathic doctor like myself, does a saliva test called an adrenal stress index. This test will show you how your cortisol levels change during the day. There's 4 times of the day that are tested: morning, around noon, afternoon, and nighttime. It should also test your DHEA levels. DHEA is another hormone produced by the adrenals. Blood cortisol and DHEA levels cannot be used to assess the stages of adrenal fatigue. You need a saliva test. So here's what stage 1 adrenal fatigue looks like. I call this phase the stimulation phase. Stage 1 of adrenal fatigue is the one people are least likely to seek help for because they usually don't feel too bad. In this stage, people sometimes describe feeling alert and energized. It often comes about after or during a time of stress or anxiety. Imagine the feeling of anticipating some big event the following day. You aren't very hungry, you can't sleep well, your mind's racing, your body might feel tense, you might feel excited or anxious. These feelings come from elevated epinephrine or adrenaline and elevated cortisol. But instead of having those feelings come and go quickly, Stage 1 adrenal fatigue sufferers may feel like this for many months at a time. So this is what it looks like on a saliva test. Your cortisol levels over here are going to be elevated throughout the day. So they'll start off high in the morning, which is fairly normal, and then they'll stay high through the night, which can create insomnia. Eventually, the adrenals will tire of creating excess adrenaline and cortisol for so long, and they'll be unable to sustain the production. That leads us to stage 2. The hallmark of stage 2 is a feeling of depletion. The adrenaline and cortisol that was acting as a potent fuel in stage 1 will now be produced only in fits and spurts. So in this stage, people will have periods of higher anxiety alternating with periods of fatigue. Or they may feel bursts of energy during a few hours of the day and then crash in the afternoons. Energy levels and moods will be inconsistent, so cravings for caffeine and sugar will be intense. I often find patients in this stage will feel that they need coffee in the mornings and wine at night. It's hard for them to wake up, and it's also hard for them to wind down. So this is what it looks like on a saliva test. They may have high levels of cortisol in the morning, and then a pretty big dip in the afternoon, and then it may rise again at night, leading to insomnia. Since DHEA levels are also starting to get depleted, symptoms of sex hormone imbalance may also start to show up. Sex hormones are estrogen, progesterone, and testosterone. And that leads us to stage 3. Okay, so now the last stage, stage 3. Stage 3 of adrenal fatigue I call burnout. It's often when the adrenals are out of fuel. Adrenaline, cortisol, and DHEA levels will all be low. Most people in this stage will feel fatigued for most of the day and will have a generally flat affect. Everything feels hard. Coffee and sugar may still produce a little energy, but not as much as they once did. The low adrenal hormone levels can contribute to things like PMS, infertility, menopausal challenges, low thyroid, and poor digestion. It probably comes as no surprise that stage 3 is often when people seek support because they simply cannot function as they once did. So this is what it looks like on a saliva test. As you can imagine, cortisol is low all day, so this person will have a hard time getting out of bed, feel tired throughout the day. They may get a little burst at night, or they may just crash into bed. So there you have it. Those are the 3 stages of adrenal fatigue. You may be able to tell, based on your symptoms, which stage you're in, but I still highly recommend that you get tested so that you can start your road to recovery with the most targeted protocol possible. It may be easier to recover from phases 1 and 2, but even stage 3 adrenal fatigue is completely reversible.